Hey guys, it's Romney Humphries and Emily Bentley here at Vanderbilt University Medical Center. We're chatting about non-fermenter susceptibility testing. So Emily's got another question for me.
Are Efflux pumps the main mechanism of multi-drug resistant and non-fermenters?
Yeah. And so, yes, we do see efflux as being a real challenge in these non-fermenters. So I'm going to focus in on Pseudomonas because we know the most about it. So the first question is, what the heck does multi-drug resistance mean in these bugs, right? Because I know we all struggle with this.
Right.
And so there are two kind of currentish definitions. So the CDC uses one which was essentially based on a publication by Maggiorkas and colleagues, where they looked at resistance to at least one drug in 3 or more categories. And those categories were aminoglycosides, carbapenems, cephalosporins, monobactam, that's just aztreonam, fluoroquinolones, the beta-lactam, beta-lactamase inhibitors, fosfomycin, and polymyxin. So if you're resistant to and these are just ones with activity against Pseudomonas. So if you're resistant to meropenem and cefepime and Cipro, multi-drug resistant. Okay. Yeah. That's kind of an old school definition though. So now we're talking about Pseudomonas aeruginosa as being difficult to treat. And so that means they're non-susceptible, so intermediate or resistant to meropenem and imipenem and ceftazidime and cefepime and aztreonam and Cipro and levo and piptazo. So difficult to treat because there's like nothing
No
left.
option.
No options. Yeah. So how do they get that way? And so this is like all of the different types of efflux superfamilies that have been found in Pseudomonas aeruginosa. But the one that we think about the most is called this R&D efflux. And there's a bunch of them like MEXXY, MEXAB-OPRM, MEXCD, MEXEF. And these guys result in aminoglycoside resistance. You know why Pseudomonas aeruginosa is intrinsically resistant to the tetracyclines? It's because of these effluxes, the fluoroquinolones, and most beta-lactams. There's some exceptions. Remember, we talked about ceftolozane tazo, like it's not as affected by this. But these work in concert with all these other resistance mechanisms. So you can't just have efflux. Sometimes you need efflux plus AMP-C, that PDC, or efflux plus a porin loss, or efflux plus an aminoglycoside modifying enzyme to really get you that full big resistance that we see. So usually with gram negatives, these things work together. So it's kind of hard to say where's the smoking gun for what is causing the resistance because it's like a couple of things working together. So to answer your question, yes, efflux pumps are very important, but they're not the only game in town when it comes to SUDS.
It's just as common in Pseudomonas.
Yes, most common in Pseudomonas. Yeah.